Hi, this is Dr. Michael Ryan with Missouri Vein Care, answering a question people ask, which is, could the fibromyalgia that I've been diagnosed with actually have something to do with my vein condition? And the answer is, for most people, no, but for some, yes. And part of the problem with the diagnosis of fibromyalgia is that we don't really know exactly what the cause is still, even today. It has a number of symptoms, and the symptoms to a significant degree do overlap, and are, in other words, they're identical with symptoms you can see with a vein condition, with some differences. One of the big differences is fibromyalgia typically involves pain and achiness and tenderness in muscles throughout the body, muscles and joints throughout the body. A vein condition really is affecting only the legs and the muscles in the legs, and not anywhere else. Other symptoms that are very similar between both a vein condition and fibromyalgia are the fatigue that people experience. The fatigue problem with a vein condition is typically more evident as the day goes on, so it's more evident in the evening or at night. Fibromyalgia seems to be, fatigue is precipitated by activity, where you're moving and walking and throughout the day, so it's not necessarily predominantly in the evening. So that's another clue as to whether this might be due to a vein condition. Some people I see haven't really had a very systematic diagnosis of fibromyalgia, but they've been told, oh, I think you've got fibromyalgia, and in fact it is a vein condition for the reasons I just stated. The muscle symptoms are primarily in the legs. The fatigue is primarily as the day goes on towards the afternoon, evening, rather than throughout the day. And the other parts, brain fog or fuzzy thinking, is primarily present in the evening when people are just exhausted, not throughout the day. So if you have a pattern that's typical for a vein condition, which is symptoms in the legs only, and your symptom pattern is more prominent in the evening or at night, then it's highly likely that what you may have been told is fibromyalgia is a vein condition and would respond to treatment. The best way to get that sorted out is to get a vein ultrasound. By looking at the veins under the skin, you can see if those veins are not working properly, causing stagnant circulation in the legs. And that stagnant circulation is what triggers an inflammation reaction. And in a way that we don't completely understand yet, fibromyalgia does have an inflammatory basis for all the symptoms and all the patterns. It just isn't clear exactly what causes it and also what can be done to treat it. But for a vein condition, the source of the inflammation is that stagnant circulation. That can be treated. And the treatment can begin with wearing compression stockings, and then if that's not satisfactory to you, then a vein treatment will most certainly improve the situation. So this is Dr. Michael Ryan answering the question, could fibromyalgia actually be a vein condition?